My name is Don. I found out my prostate cancer had become advanced, I guess, about 6 months ago. And all of a sudden, I realized my life expectancy may not be quite as long as it otherwise might have been.
I was diagnosed in 2014 with a PSA level of 589. I sort of had to come to grips with myself, having this diagnosis. I was afraid, I was angry.
I mean, you've got to look forward to this stuff. I mean, you can't get all upset. You can't write your life off and say this is the end. This is the beginning of a new phase.
Well, everyone that I've met, really, everyone that I've met, have just been phenomenal. They really have. Oh, they treated me fabulously.
I'm Dr. Ben Lowentritt. I'm the Medical Director of the Advanced Prostate Cancer Program at Chesapeake Urology. What is advanced prostate cancer? Really, advanced prostate cancer means a couple of different things and can discuss different stages of the disease. Essentially what it means is it's a prostate cancer that we don't think we can cure. And that might be for several different reasons. Some men, when they present with prostate cancer, it's already spread to other organs, what we would call metastatic prostate cancer. That is a form of advanced prostate cancer. Other men may have been through treatments in an attempt to cure prostate cancer, either surgery, radiation, or some other type of treatment, that has failed, and we have evidence that the cancer is coming back. So the first-line treatment for someone where we don't think we can cure them from one of the other types of treatment, as I mentioned before, is hormone therapy. It's essentially usually injections that are given to block the natural production of testosterone by the testicles. Prostate cancer feeds off of testosterone, so our ability to restrict that fuel gets the cancer to be more well controlled. Provenge is a form of immunotherapy specifically for advanced prostate cancer. Immunotherapy is a broad term that means we're actually using the body's natural defenses to fight the cancer. Provenge is a process, actually. It's not a specific drug, but it involves taking some of your own immune cells, retraining them to fight the cancer, and then giving them back to you. The benefits of Provenge are multiple. Mainly, it's a very well-tolerated treatment. Patients get through it without much problems at all. It only lasts a few weeks, so once you've completed it, you're done with it. It's not something that goes on forever. And most importantly, it extends life.
Hi, my name is Christy Reese. I'm the Infusion Manager here with Chesapeake Urology's Infusion Center, and I believe what makes our center unique is the personalized care that our patients receive. We are dedicated to treat only patients with advanced prostate cancer. So I think that makes our patients feel a little more at ease, that they know, they're going to come in and it's only going to be male patients and they can talk about their experiences with one another. We have one nurse who's dedicated to their care, so they'll see her from start to finish.
Hi, my name is Barb Reinard. I'm the lead infusion nurse at Chesapeake Urology Infusion Center. When patients come to our infusion center, you have to know that they feel frightened. They come here at a very pivotal point in their life. They've been told that they have a disease that does not have a cure, but that we can help them to extend their life and hopefully the quality of their life. Our center has been set up so that we try to make it as welcoming and as user-friendly for our clients as possible. We try to put them at ease when they come in. We have comfortable recliner chairs that they can position. We have a machine that's called a blanket warmer, and it's probably one of the best things we ever purchased because it really puts people at ease to have a nice warm blanket. I mean, we kind of all resort back to like our childhood. When you have a warm fuzzy, it makes a big difference.
We talked earlier about first-line hormone therapy, which is limiting the natural production of testosterone, which restricts the growth of the prostate cancer. Unfortunately, as these prostate cancers learn to adapt and try to grow, it no longer responds to that first-line hormone therapy, and we see a PSA going up. We see scans showing new spread of cancer. It's very frustrating because what ends up happening is the cancer itself starts to make its own testosterone. We now have second-line hormone therapies that actually can limit the ability of the cancer to make its own testosterone or recognize that testosterone even after it's made. Pain related to the metastasis or spread of cancer, especially in the bones, can be really one of the debilitating things about prostate cancer. We now have a treatment which is radium-223, or the brand name is Xofigo, which can go to wherever the cancer is throughout the bones and actually treat it there. Chemotherapy, which is a traditional form of treatment of the cancer, directed with chemicals that are directed to kill the cancer cells themselves. Thankfully, chemotherapies have evolved and they're not as hard on people as they used to be. But with these newer treatments that seem to have less of an effect on quality of life, chemotherapy often is no longer the first-line treatment, but is further down the line.
My name is Dr. Ronald Tutrone, and I'm Medical Director of Clinical Research at Chesapeake Urology. Clinical research is very beneficial to patients in that it allows them to become more engaged in the treatment of their disease, which translates to better health outcomes. It also, and very importantly, affords them access to treatments that may not be commercially available or FDA approved yet. Prior to the late 1990s, there was very little to offer patients short of chemotherapy and hormonal therapy. Over the past 6 years, with the development of all these new drugs as a result of clinical trials, we've been able to not only extend patients' lives with advanced prostate cancer, but we improve the quality of life, and that's very important. This is what keeps me going to work every day. It makes me feel good.
The hope is that we can turn it into a less scary disease. We continue to strive every day to bring on new treatments, to bring on new trials, and have our best people working all for the same goal, which is to help our patients live longer, happier lives.
I cannot allow cancer to control me. I cannot. I realize that it's a fact. I can't let it control what I do.
Never give up. Just keep plugging away, and it'll work out. I mean, if the attitude of the people that take care of you is any indication, you'll be successful.